Welcome to the latest installment of the Health Storytelling Author Q&A series for this academic year of fall 2024 and spring 2025. I'm Maryn McKenna. I'm a journalist and author and senior fellow in the Center for the Study of Human Health at Emory University. I'm the curator of this series, which makes me your host as we undertake our latest series of author conversations. In a moment, I'll introduce you to my guest, journalist Lina Zeldovich, and her amazing new book, The Living Medicine: How a Life-Saving Cure Was Nearly Lost and Why It Will Rescue Us When Antibiotics Fail. But first, let me tell you about this series. At least once per month during the academic year, we invite writers whose journalistic or academic books examine health, the science of health, and the science and history of health, and also health's intersection with society. The series of conversations is sponsored by the Emory Center for the Study of Human Health, along with an array of fantastic co-sponsors. This autumn, they've been the Georgia Center for the Book, a local affiliate of the Library of Congress that stages very frequent public conversations with authors, illustrators, poets, and others to bring news of new books to the public. And Science Gallery Atlanta, which presents exhibits that ignite creativity and discovery where science and art collide. Their new exhibit, Resilient Earth, is running now. And plus, this year, we've had two new co-sponsors for this series, Emory's new Center for Public Scholarship and Engagement, which creates opportunities for faculty, staff, and students to share ideas with local and global audiences, and the center's inaugural Ideas Festival, which took place in September on Emory's Oxford campus and will return next year. Here's who's been appearing in this series, which is live streamed on YouTube, LinkedIn, Facebook, and Instagram, and archived on YouTube. Tonight, as I told you, we'll hear from Lina Zeldovich, who'll talk about the history of bacteriophage therapy. It's related in her fascinating brand new book, The Living Medicine, which is just out from St. Martin's Press. In October, we heard from journalist Lynn Peoples about her then brand new book, The Inner Clock: Living in Sync with Our Circadian Rhythms, which was published by Riverhead Books in September. And earlier this autumn, we heard from Emory Associate Professor Rachel Hall Clifford, PhD, with Underbelly: Childhood Diarrhea and the Hidden Local Realities of Global Health, which was published by the MIT Press in May. One final note. This is a live event. You can interact with us, and we encourage you to do that. If you want to ask a question, please comment on any of the platforms where you're watching us. And our producer, Stefan Kaplan of Spin It Social, will make sure we see what you've said. Do note that I'll turn to your questions in the second half of this live stream, but you can put in your questions at any time. I encourage you to do that, and we will see them. Now, let's turn to our book and guest. Lina Zeldovich grew up in a dissident family of Soviet scientists and learned English as a second language in her 20s as an immigrant to the United States. She attended the Columbia University School of Journalism and has written hundreds of stories for publications such as Popular Science, Scientific American, Smithsonian, National Geographic, and the New York Times, basically all the glossy science magazines that you'd see in a Barnes & Noble or in an airport bookstore. She's also the author of The Other Dark Matter: The Science and Business of Turning Waste into Wealth and Health. She lives in New York City. Lina, welcome to this series.
Thank you for having me here.
So I am so fascinated myself by the history of phages, and I can't wait to talk to you about them. But I think before we get into the science and the amazing and troubling history, we need to hear a little bit about you first. So can we start with what drew you to this story?
Well, as you said in my introduction, I grew up in the Soviet Union, where bacteriophages and antibiotics were both used. When one didn't work, they used the other, and if they didn't have one, they used the other. There's an interesting history to how it happened, and uh, because I grew up there, I knew a little bit about it, and as I came to the States and became a science journalist, this story drew me, kind of like stuck with me. I was always curious why I were not using them here, and every so often there'd be a story, in the New York Times or in Wired or someplace else that talked about bacteriophages, but it seemed like we never really made any progress in getting them to the clinic. And in recent years, that began to change. And so this concept was so interesting to me that early in the pandemic, I started talking about my agent about the fact that, not all viruses are bad. And it's a really fascinating concept. And so we conjured up a book proposal. And 5 years later, there's a book.
Congratulations.
Thank
So
you.
the journey that you went on of knowing about phages or phages, does it matter which way you say it?
No, it's like it's literally half and half. Half the scientific world says phages and the other half says phages.
Okay, I'm going to stick with phages then. So what's fascinating is that the journey that you just described of knowing about phages and coming to the United States and wondering why they weren't used is a journey that one of your characters also goes on. And we're going to talk about that in a couple of minutes. But first, I think, I'd like to hear a little bit more about you and your family, because among the watchers of this series are students who may be in their early 20s, or junior faculty who might be in their late 20s or early 30s. They might not remember when the Soviet Union opened up to the West or what came before. So in your introduction, you describe your family as being dissidents. I think we need to know what that means.
Sure. So I grew up in a family of scientists. My father was a physicist. My mother was an airplane engineer. Basically, everybody in my family was either a scientist or a techie or a doctor. That was the house I grew up in. Um, at some point, my parents decided that they didn't like where the country was going. I think they never liked where the country was going, but at some point they decided to become vocal about it. Their scientific careers went down the drain, and they wanted to leave the country because once you kind of, make your unhappiness known, it becomes fairly dangerous to stay there. They couldn't leave because at the time you just couldn't leave the country. They weren't allowed to. And that continued up until the late 80s when Gorbachev came to power and he changed things. And that's what they call perestroika, which basically means reconstruction. So he was reconstructing the Soviet Union, and as a result of the way the Soviet Union fell apart, the Iron Curtain that separated the East from the West for 70 years also fell, and people were allowed to leave the country and travel and whatnot. And so at that point in 1990, my family came to New York, and I've pretty much been here ever since.
Did your family manage to continue being scientists when they came?
Yes and no. Basically, they switched to information technology. Yeah.
So this story of repression in the Soviet Union is so important to the history of phages. And I don't really know which character to start with, but I do want to say that I have been working as a science journalist long enough that I was working when the wall, the Iron Curtain, came down, and I remember the discovery in the Western media of the phage science that you describe, that had been not just hidden but treasured and curated and protected in the Republic of Georgia for so many decades, and the incredible fascination that people here in the West had for this science. And you, because of your background and the languages you speak, are uniquely equipped to tell this story to us. So let's get to it. So I guess we should go right to the beginning with the two scientists who really cause in the 20th century cause phage science to be elaborated, Eliava and Durrell.
Right.
Pick one, tell us about them.
Okay, sure. So it's actually one kind of doesn't happen without the other. In the Western world, Durrell's name is better known because he was on this side of the Iron Curtain. A lot less known about Georgi Eliava, who was a Georgian, but basically what happened is they stumbled upon the phage phenomena at about the same time, around 1917, one in Paris, one in Tbilisi. And what they both saw was that when you have an infectious agent such as, dysentery-causing bacteria or cholera, under some circumstances, it mysteriously disappears from the sample or from the water that they're studying. And so Durrell called it a parasite of microbes because he realized something was killing it. Eliava, who was younger, a little less experienced, didn't have an explanation, but he observed it over and over. And in 1920s, Eliava came to Paris to study at Pasteur's Institute to learn how to do things like vaccines and serums and other medicines, because that's how medicines were made at the time. The scientific world in Paris was laughing at Durrell because they didn't think that he really found something that killed microbes. Remember, those two viruses, and in 1920s, microscopes were not strong enough to see viruses. So he was like a laughingstock of the scientific community. So there comes this Georgian scientist who says, wait a second, I have seen the same thing. And interesting, so they were very different people. Durrell was kind of like prickly and like he would like tell people what he thought. And didn't care how it came and whether people liked his comments or not. And Eliyahu was incredibly charming. And he also was a very eloquent speaker, spoke multiple languages. And in his daughter's memoir, I read, she wrote that even when he talked about science, it sounded like poetry. So he goes to the director of the institute and says, I have seen the same thing. Can I do this experiment, Stu? I'll show you that, yes, this is what happens. And he basically sweet talks him into it. And he repeats Durrell's experiments, and he shows that, yes, infectious agents disappear from a sample under certain circumstances. And from that point, they were basically like father and son. Like they clicked and they stayed friends and collaborators for life.
So at first, they're looking at this just in samples, as you say, but there must come a point when because they're looking at pathogens and seeing that pathogens are being affected in their samples, when they actually try to do something about the pathogens, right? To effect a cure. So take us through how that happens.
Sure. So the first time anybody was ever treated by phages was, I think it was in 1990, just about the time when they're both in Paris, and there is an outbreak of dysentery in Paris, and very sick children in the children's hospital in Paris. And Durrell says, I think I have something that might cure them, so let's give it a shot. And there's no alternative. There are no antibiotics or anything. Like the kids will either live or die. So Durrell brings a vial of phages, and the doctors in the hospital drink them, on day one, everybody stays okay, and they give it to the sick children, and the children recover within 24 hours from bloody diarrhea. And that is the moment when they realize that this actually can be used as medicine for real.
So did this just come out of nowhere? Was there a folk history in European culture or elsewhere that outlined that something like this was possible? As you say, in the 1920s, people couldn't see viruses yet. They barely could see bacteria. But even though the organisms couldn't be visualized, were there past experiences or folk tales of something like this working?
Not folk tales per se, but sometime in, I believe, 1800s, there were some interesting reports that cholera seemed to disappear from the Ganges River.
Mhm.
Um, and nobody could quite figure out why. It didn't disappear from just like wells of water, but it did disappear from the river. And at some point, the British troops who were there investigating, how cholera starts. So what happens? They actually wrote in the report that drinking the water from the river is more salubrious than drinking it from the wells. But again, nobody had any explanation to that whatsoever.
And how do we get to the point where these investigators start to understand that this actually is an organism, that it's something that grows and reproduces and can be manufactured?
So there were certain things they could see under the microscopes, and what they could see was bacteria itself. And what they were able to observe is that, so they, under the microscopes, what it would take some time, and then these bacterial cells would start to swell, like rather, from being, let's say, oblong or whatever shape they would start to swell. It would turn into this swollen round puffs, and you could see that there was something pushing them from the inside, and then eventually they would burst. And so what they concluded is that the tiny little organisms that they couldn't see had a way of getting inside the bacteria, multiplying at its extent, and popping them open, which is exactly what happens. Like today, we know that this is exactly what happens.
So as the investigators start to understand that this is a thing, an organism, and that this is a reproducible effect, this turns from being just experimental work into really an entire branch of medicine, right? I mean, there become institutes and there become laboratories, and there are people making these things and deploying these things. So talk about that horizontal expansion of phage science.
Right. So I think one of Durrell's really high points was that he managed to cure bubonic plague in Egypt with some of the phages that he acquired from rat feces in India, because rats are apparently okay with being infected with bubonic plague. They don't die. So he got some phages there. He kept them for some time, and he used them to cure, I forget, 3 or 4 sailors in Egypt who otherwise would definitely die. There was no cure for that back then. And that seemed to have really big effect on the medical community. And I would say in 1920s and early 1930s, phages were a big thing. A lot of companies made them, and they made them for various infectious diseases. Doctors use them on patients all over the world, in America, in South America, in Europe, in India. And then an interesting thing happened. Because there was much less oversight over how medicines are prepared compared to today. Not all these phage preparations were done right. There's a very specific thing of how phages have to be prepared, how they have to be grown at the expense of bacteria. It's typically one phage for one bacteria. It's like one-to-one correspondence. If you don't have the right phage for the specific bacteria, it's not going to work. So people who didn't know or didn't care to prepare this phage cocktails properly ended up with medicines that didn't work very well. And then just like everything, things sometimes become a fad. And some companies started advertising phages against just about anything like a panacea. They advertised them against fungal infections, against flu. It's not going to work against the flu. It's a virus. Allergies and whatnot. So there came a point that phages, unfortunately, discredited themselves, maybe not so even in the public eye, but in the physician's eye. And physicians started questioning whether they really work.
And you make the point in your book that in the the powerful American medical journals in, I think, the
Right.
1930s,
Yep. Yep.
commissioned some examinations of this enthusiasm for phage science and conclude that phages don't work. Despite all the evidence in Europe and Georgia and Russia that, in fact, they are curing people, American medicine decides that phages should be put on the shelf.
Yeah.
And at that point, there's this incredible diversion between the experience of phage science sort of in the old world and the new world.
Right. Yeah. It's very interesting. There were two very prominent physicians who looked at all the phage literature collected. And yeah, that's what they kind of decreed. Phages basically don't work except maybe for staph, maybe. And yeah, the enthusiasm died pretty quickly. And remember, this is the 1930s. So in 1940s is when we figured out how to mass produce antibiotics. And at that point, phages just basically completely disappear from the scientific radar in the West.
We should remind people of that timeline. 1928, Alexander Fleming, for the first
Yep.
time, perceives the action of penicillin on a dish in his laboratory in London. 1940, it gets elaborated into a drug given to a human for the first time in 40 or 41.
Yes.
And 1943, I guess penicillin starts to roll out on the battlefields of World War II, completely changes the course of the war. Sparks enormous enthusiasm all around the world for the action of antibiotics, which we'll get to in a minute. But in the meantime, phage science is still puttering away in the Republic of Georgia, right? Where Eliava has become kind of a local or a national hero for what he's done.
Yeah. Yeah. So there was a time when he indeed was. So he had really big plans. In Soviet Union at that time, there was a period of time the Soviet Union was really heavily investing in medicine because the belief was, you have healthy people, you have a healthy country. And so he invites Durrell to come over and work with him. And Durrell, he sort of like comes and goes. He comes and stays for a few months, and he sets a bunch of experiments, and he writes all this guidelines of how phages must be grown. And he writes a book in French, which Eliava translates into Russian, and they dedicate it to Stalin because that's what you have to do. It's a politically correct move, and yada, yada, yada. In early 1930s, Eliava manages to receive a huge sum of money in millions of dollars to build a bacteriophage therapy center and production center in Tbilisi. And there are plans and when I was there, I was looking at this plant. It's a really, really modern facility, even by today's standards. Like they had this hospital laid out, and there were this wonderful rooms where one or two patients were supposed to be in. I mean, his vision was really incredible. But at the same time, the Soviet Union is entering a very interesting era. Stalin is becoming more and more paranoid by the day. And in this climate, it becomes very important who has his ear. And unfortunately, a person who has his ear is Lavrenti Beria, which eventually goes down in history as one of the probably cruelest person in the 20th century. And he was also Georgian, and he was just rising to power in Tbilisi. And there was a lot of Georgians don't like him. Nobody likes him. Everybody knows what he's doing, and some people keep quiet about it, but not Eliava. So when there comes a time when Stalin's orders purges, and he wants everybody who even is under slightest suspicion of maybe not agreeing with the Soviet power, when he wants everybody cleansed, the Beria gets vindictive. Despite all of that, despite the fact that the science center was already being built, so Eliava is arrested. His whole family is arrested. He's in prison. He's tortured. And when I was researching there, when I was reading the records of his, his arrest and his questioning, it is really maddening to what extent is absolutely illogical. So, like on June 3rd, his interrogators are, writing that he's confessing and spying for the British. Like 3 days later, they're writing that he's confessing and spying for the French, and 5 days later, he's confessing that he was conspiring to poison the Soviet citizens with bacteriological microbes. The line from the report, I think, doesn't make any sense. And then you can see that from some other literature that the two groups of people that are interrogating him can't even agree on what they want him to say. So
it's so impressive that you were able to read those original archives in the original languages. I think that, I mean, the Eliava's story has been told before, but the thing that's really remarkable about your book is that you really go back to the original literature in the original languages and bring this out in a way that no one before has been able to manage.
Yeah, I would say it was a journey. I mean, I grew up hearing stories like that. It was part of my childhood, but that was really, something that like stayed with me for a long time.
It's really haunting, the section of the book that talks about Eliava's and his wife and his daughter's arrest and interrogation and torture and eventual death in custody. The daughter, as you survive, as you say, you read her memoir afterward. But as tragic as that is, phage science doesn't end with Eliava. That is something that I think is really remarkable and hopeful. The Republic of Georgia recognized, not a republic at the time, recognizes it as a local treasure and somehow manages to protect it for decades more.
Yeah, for decades more, exactly. And I think one of the reasons for that is the Soviet Union was kind of a very different medicine. The Soviet Union was a very different ecosystem than it was in the States. You name it, name a substance, there was a shortage of it in the Soviet Union.
Mhm.
So the medics looked at how they treated patients differently. They used whatever was available today, and if it wasn't, they used the next best thing. And that is why the two modalities developed sort of hand by hand in the Soviet Union. Here we didn't need it. We just ka-chinked our antibiotics until they worked.
Looks like Lina has frozen. We'll try to get her back. I'll take this opportunity to remind everybody that we can see your questions. I've got two excellent ones already. I'm really looking forward to asking them as soon as we can get Lina fired up again. Anyone else who is interested in talking about this history, please put your questions in the box. And as soon as we get Lina back, we will ask them, because we are now in the second half of the hour where we start to ask questions from the audience. As you can see, I have plenty of questions of my own. Lina's on her way back. I'm just going to vamp for a minute and say that this book is really fantastic. And I'm so glad that I had the opportunity to read it. And not just because Lina cites me in it, because two of my books, which you can see behind me, are about the history of antibiotic resistance, the story of how phages were almost lost and then came to be recovered again, and starting to have how their power was starting to be recognized is really, really remarkable. All of you who are interested in phages might want to take a look at a book called The Perfect Predator, which is a story that we are going to pick up in just a minute about how phages have come back to clinical use in the US. Lina, welcome back. I was vamping until you got here.
I don't know. I think
Okay.
I just had a burp.
So we're getting some comments, and I want to bring the story up to the point that where we can start asking these questions from the audience. So where we were in our previous episode was that Eliava had discovered phages. They were greatly elaborated in the Republic of Georgia with the backing of the USSR. Then the USSR, embodied by Stalin and Beria, turns against them. Eliava is tortured and murdered. Phages persist. And then perestroika happens. As you mentioned earlier, the wall comes down, the Soviet Union opens up to the West, and there is phage science. But at the same, and the reason it seems so remarkable is that what's been happening in the West, which has had antibiotics, which were not available in the Soviet Union, is the rise of antibiotic resistance and the realization that antibiotics are losing their power. And you have a character who
Right.
physically embodies this because he comes from Georgia and comes to the United States and discovers firsthand the ravages of antibiotic resistance on patients. So tell us about Sandra.
Sure. So Sandra, or Alexandra, Sulachville is a Georgian who in early 1990s comes to the state as a postdoctoral researcher for something like 9 months of fellowship in the University of Maryland, and starts working with Glenn Morris, who is an infectious disease physician. And Sandra himself has been working on various infectious agents. And so one day he is toiling in the lab, and Glenn, who was a practicing physician, it comes in and he doesn't look like himself. And Sandra asks him, what happened? Like, what's wrong? And he says, I just lost a patient to an antibiotic-resistant, infection, and I don't know what to do because these cases are not responding to antibiotics anymore. And Sandra, without thinking much, says, have you tried a bacteriophage? And bacteriophage didn't work either. And Glenn just gave him that stare because he never heard of bacteriophages being used to cure people. And that Sander had this moment of reckoning that basically he remembered for the rest of his life. Somebody just died in a country that has an incredible medical system compared to the country he came from, and he died from an infection that could be treated in his hometown with a medicine that can be bought in just about any pharmacy. And so he took it upon himself, basically spent the rest of his life working on getting this medicine to the clinic in the United States. And it was a really
So
long and hard road because, and phages were very, very, very discredited by then.
So what Sandro and Glenn Morris at the University of Maryland were running
Maryland.
into was that long suspicion of phages in the United States as something inferior to antibiotics, something unpredictable, something that was not reproducible. What do you think? What turns that around? How is it that we've gotten to a point now where you can write this book and have it be embraced and have it be a story that is turning out to be a positive story where people are interested in this science again?
Right. So we really have to like fast forward to just a few years ago. And that's the what I call the perfect storm, in my book was the case that, some people here even might know about. It was the case that, so Stephanie Strasty, her husband, Tom Patterson, almost died from an antibiotic resistant Acinetobacter baumannii, which he accidentally picked up in Egypt. She was a scientist herself. And so when basically they ran out of all antibiotics, she started looking for an alternative. And she had the education, the background, and the drive to learn about these phages literally within days, to contact a whole bunch of labs and ask them if they can, find phages for the bacteria that Tom was infected with. And she had the medical support and backing that she could actually gather these samples and send them when they got tested. And so, she worked with one lab in Texas and also with U.S. military, who turned out to have a whole collection of phages. By then, there's a story to how that happens, whole separate story. And so, as a result of all that, Tom didn't die. But what they did is that they got the first ever green light from the FDA to test this as an one-off case basis, because there was nothing left to lose, and it worked. Tom didn't die. And that changed everything.
I find the story of Stephanie and Tom just amazing. I've met them. I've read their book, The Perfect Predator, which has since been turned
Mhm.
into a documentary. And they are an incredible romance, but they're a romance that sort of Stephanie single-handedly sort of bullies phage science back into
Yes.
currency in the West in order to save her husband's life. And then subsequently, after he survives, they found a scientific center at the University of California, San Diego, which is dedicated to conducting clinical trials on
Mhm.
phages. And from them, it feels like to me, there's a whole renaissance of phage science here in the United States that rejected it or discounted it for so long.
Yeah. Yeah, for so long. And, when I was writing the book, there were at least 50 clinical trials, in progress, in different parts of the states, in different labs, in different, universities. Sandra's company, Intralytics, now has at least three, maybe even more since the last time I talked to him. So he founded his company in 1998. In 2018 was when he finally got his, permission to, run his first clinical trial. So a really long time. Yeah, that's, a lot has changed since then.
So where we are right now, um, there are these incredible miracle stories. But the
Hmm.
question is, how is phage science going to become regularized, become a regular part of American medicine? What do you think stands in the way?
I think at this point, what stands in the way is time and money. I think we've broken the dogma. Um, and there is a belief that phages are definitely an alternative, but time and money is what we still have to overcome because trials take time and money. And what works in phase one doesn't work in phase two or phase three, and whatnot. Um, the FDA has an idea of how they're going to regulate it, basically the same way they regulate vaccines. Now they just need to see that, phages are efficient at what they're supposed to treat, and at some point in the future, they are, we're hoping to have them in the clinic. But again, time and money, as always, that's what we have to overcome.
I remember being at an FDA meeting that was talking about phages a couple of years ago, and investigators who were there were talking about some of the miracle stories. I think probably at that point, Tom Patterson might just have recovered, but there were a few other stories that were circulating of people who, after the wall fell and people heard
Mhm.
about this magic cure in the Republic of Georgia, they started going off on their own, right? Like they heard about it and they got on, if they had a severe infection of some kind, let's say a diabetic ulcer on their foot or something like that, they'd get on a plane and they'd go to Georgia and they'd try to find the Eliava Institute and they'd submit themselves to treatment and then be
Mhm.
cured and come home and tell people. So the miracle stories sort of, as I recall, they kind of like trickled out for a while, for maybe a decade or more. But what these FDA scientists
Mhm.
said at the meeting I went to, which was so interesting, was that that miracle stories were kind of like not what they needed. What they needed was for people to stop saving individual lives and start constructing clinical trials so that in the next phase many more lives could be saved because they'd had the discipline to set the trials up. And that seemed to me such an interesting conundrum of, you want to
Mhm.
save individual people, but you want the population to benefit as well.
Right, right. I have to say that since my book came out, I've had some people reached out, some European um, uh, entrepreneurs reached out to me and say, "Why is your country so slow in
Mm.
adapting this therapy? Like we are working faster in Europe." We understand that you need trials and whatnot, but you need some kind of an intermediate measure so that people who are dying from something that can be cured with antibiotic right now wouldn't die, or people who are losing their limbs because um, they've got this infection that they can exterminate. You need some kind of an intermediary measure, and it's an interesting concept, and I certainly don't know how it can be orchestrated, but it seems that at least in certain countries in Europe, they are finding alternatives.
And so, do you envision, or the scientists who you spoke to, whom you interviewed for the book, do they envision that we'll have a sort of, I don't want to say tiers, because tiers implies like valuation, but a two-track infectious disease system where we're using antibiotics and we're also using phages? How will that
I
work?
think that's a great question. I think generally from what I've seen, and as a journalist, the way things tend to work is that you use the established, the established standard of care. The established standard of care in the States, antibiotics, this is what we're going to use. And when they fail, then we're going to use phages. That would be my guess, because that's typically how things tend to work.
Mm-hmm. So I wonder if, I mean, I'm sure you talk to people who are sort of in the investment space or the business space and are thinking about whether phages could be a target of investment the way like new drugs are.
Right. Yeah. Oh, it is definitely. At this point, I would say this is in the millions, because people realize that this is probably the next frontier, at least for certain things. There's an interesting thing about phages is that you can't patent a phage because it's a natural organism, just like you can't patent the sun
Okay, that's a
or
problem for a drug company, isn't it?
yeah, that is a problem. But what you can patent is you can patent a cocktail of phages in which you have,
Mhm.
let's say, multiple phages against multiple strain of E. coli, or or you can have multiple phages for multiple intestinal diseases, let's say, salmonella, E. coli, listeria, and things like that, that you can patent. And I think that's what they're going to go after. That's what they're going after.
So those would be clinical treatments. They would
Yeah, those
be
would be clinical treatments.
administered within medicine. It won't be like in the old Republic of Georgia where it'll just be sitting on the shelf of a pharmacy for anyone to buy.
That's another very good question. I don't know. I suppose it could be either way. I think it all depends on what ultimately they will work out with the FDA.
So
Yeah.
I want to go back some more to your reporting. As you were reporting this complex and in many cases sort of lost history, were there any were there any moments that really stood out to you that made you think this is a story that has to be told?
Almost at every step of the way. I mean, for starters, I really wanted to people to know the story of Eliava and his family, because it was completely forgotten. Nobody. It was really an untold story. Others, the other interesting thing that really stood out to me is to what extent politics and wars really mess up science. I mean, for
Mm,
70 years, the East and the West didn't talk to each other. They could have, and also there's so much mistrust, seated between the two superpowers, that I've heard it from many scientists here, that there was just almost like a general mistrust to, like, it's commie science. There's this red tainted it can't be right. Like, we couldn't make phages work in the States. There's no way there's people out there can like make them work in their like, dirty pots and pans, because that's where phages come from. They come from lakes and rivers and sewage and whatnot. That was definitely a very interesting concept. Uh, and I think um, I think the other thing that really sort of bothered me was we really fall for dogmas here. Like,
mm,
if somebody said this can't work, um, people just not going to even try, and that there it takes somebody who I guess comes from a different background, he knew it works. And I was asking him, like, wouldn't it be like easy to give up and go do something else? And Sandra would say, but I knew it worked. Like, I grew up drinking these phages. I just couldn't give up because I knew it was working. I just had to convince people. I just couldn't give up. It just wouldn't be ethical. So yeah, he really stuck to it.
So the story of Sandro, I'm probably going to mispronounce his family name. I'm so sorry. Suluk-Velits.
So yeah, so it's
Uh,
helpful.
he really embodies the journey of phage science, because there he is from the Republic of Georgia, coming to the United States, carrying the knowledge of phage science with him, realizes that we don't know anything about it, wants to put it to the service of the place where he lives now and the medicine he's now working within, and essentially gets turned down, right? We kind of skipped over that part. He founds the company Intralytics. He
Yeah.
wants to launch trials of clinical use of phages in humans, and the federal
Mhm.
authorities say no. And what he did as a sort of a placeholder, right, for more than a
Yeah.
decade, was he made phages for food safety, because the
Yes.
regulatory bar that you had to get over was less.
Yeah. It was a lot easier to get an approval for making phages for food safety, which basically what his company was making and still making are these food sprays that you can spray on like meat and other produce that kill things that are like very typical for things like Campylobacter, Salmonella, Listeria, and like all these other foodborne pathogens that every now and then you hear that something's being recalled because they found Salmonella in someplace. And that is what kept his company afloat for quite some time.
And now he's had the triumphal moment, right? Because as you said a little while ago, he now is
Yeah,
being allowed to do clinical
yeah,
trials of
yeah,
treatment for humans.
yeah, yeah.
I hope it
They're
works.
collaborating with I believe it's Mount Sinai or in a couple of other places. Yeah,
There's something really satisfying about the fact that this person from the Republic of Georgia, the birthplace of phage science, came to the United States, brought this with him, refused to take no for an answer, and now sort of finally has his, if not his triumph, because the trials are still ongoing, they haven't been concluded, but has finally
yeah,
sees the way clear to achieving what he wanted to achieve all those decades ago. It's a lovely conclusion to the story.
yeah,
So
yeah.
when you,
Definitely.
what do you think? I'll make this my last question or so. When you think about the long journey of phage science that you were so immersed in when you were writing this book, um, what most what are the lessons you extract from it? What are the things that most stick in your mind?
Um, we tend to form opinions about things and we just kind of go with it. I think maybe in the medical field, particularly, people are very cautious about any new things, any new ideas, and quite often for the right reasons. Um, it's really interesting how medical science develops because at the same time you have to do no harm, right? That's what every physician pledges before they even start practicing. And at the same time, when you realize that things that used to work are no longer working, then you need something new. And so I think this conundrum is going to stick with us for a long time. And at the same time, we really have to move faster now because the threat of the antibiotic resistance is here. It's not in the future. It's not if, it's when. Um, and in the medical field, people really, really afraid that the next pandemic might be bacterial, and they really need to be prepared for when this moment hits. And the superbugs are rising. There's like more and more of them every year. It got worse with COVID. I tell you this funny thing. When I was researching the book, it was an official number that every 15 minutes an American dies from antibiotic-resistant infection. When I found this number, I was like, there's no way. She's like, no way. I think I'm reading this wrong. How many people die a year? About 35,000. So when I did my own math, I came to the same 15, every 15 minutes, somebody dies from an infection. And I spent an hour and I was like, 4 people died in this time? That's just mind-boggling. So yeah, we really have to move faster.
Well, and I hope that as you've described, that we can realize and elaborate phage science so that when the next pandemic arrives, if it's a superbug pandemic, phages maybe will come to save us, or at least help beat things back. It's such a great story. It's such a great book. Lina, thank you so much for coming on this program and telling us all about it. I appreciate it.
Thank you.
And that's it for this episode of the Health Storytelling Author Q&A, and also for the fall section of this year's season. We'll be back in the spring semester with a new slate of fascinating new books on health and science, probably start in January, but we'll announce our authors next month in December. Meanwhile, please consider following Lina on social media. She is Lina Zeldovich on X, formerly Twitter, and on Blue Sky. And she's SciScribe on Threads and Instagram. And buy her book, which is available at Barnes & Noble, her publisher, and at Amazon, of course, and also at bookshop.org, which is kind of the anti-Amazon. It's a platform that funnels book orders to independent bookstores, and we want them to survive. Please come back in January when we'll have a new, fresh slate of fantastic books to talk about. Until then, I'm Maryn McKenna. On behalf of the Center for the Study of Human Health at Emory University, the Georgia Center for the Book, Science Gallery Atlanta, Emory's Center for Public Scholarship and Engagement, and Ideas Festival, and from me, thank you for watching.